This presentation discusses the effectiveness of lefamulin in treating community-acquired pneumonia caused by Streptococcus pneumoniae in comparison to penicillin. Community-acquired pneumonia is a common infection with an annual average of about 900,000 cases in the United States. It is one of the leading causes of hospitalization, and although it can affect anybody, it primarily affects infants and elderly because of their weakened immune systems. It can be short-term and easily treatable. However, its ability to worsen and become life-threatening is the reason it's so important today. Streptococcus pneumoniae is a common bacteria to cause this infection. Although community-acquired pneumonia can be caused by a variety of pathogens, this bacteria accounts for over 80% of the cases reported. It grows in very specific nutritional and environmental conditions, which has made it difficult for researchers to study in recent years. Lefamulin and penicillin are two antibiotics that have been used to treat community-acquired pneumonia. Lefamulin is a much more recent option that was approved by the FDA in August 2018. Recent uses report it being a fast-acting treatment, and it works by preventing protein synthesis within the cells and slowing the bacteria. Penicillin has been used for much longer than lefamulin has, and over time the bacteria has shown more resistance to this antibiotic. To compare these two antibiotics, they were used on approximately 4,000 isolates of Streptococcus pneumoniae in a 2015 to 2016 study. MIC refers to minimum inhibitory concentration, or the amount of the antibiotic needed to fully inhibit the organism. The data in this study shows how similar lefamulin and penicillin were in treating community-acquired pneumonia by having close numbers to fully inhibit the organisms. This graph is used to show the data in the previous slide visually. This shows that there are few visible differences between the two throughout the process of inhibition. Drug resistance is another issue when comparing the effectiveness of these two antibiotics. Of 90 serotypes of Streptococcus pneumoniae, 7 show resistance to antibiotics. This resistance can cause an antibiotic to be less effective when treating an infection. 2 of the most resistant strains of Streptococcus pneumoniae, 19F and 19A, were used in the study to determine the effectiveness of these antibiotics when used on resistant strains of this bacteria. The results show that a significantly larger amount of penicillin would be needed to inhibit these resistant organisms compared to penicillin, which only doubled in MIC required from previous data. This data as well shows that the MIC of penicillin dramatically increases as it is used on more resistant bacteria. It demonstrates the MIC from non-resistant bacteria to very resistant strains. To further study this, patient satisfaction can be studied, or there can be another analysis between these two antibiotics after a lefamulin has been used more and may reveal new data. Overall, lefamulin proved to be a more effective method. Neither antibiotic worked better than the other when used on the bacteria without specifying the serotype. However, lefamulin was much more effective on the resistant strains. Penicillin's inadequate inhibition of the bacteria showing resistance ultimately causes lefamulin to be a more effective antibiotic.